I work in one of the biggest hospitals in New York City. I've been practicing for about 10, 12 years now, and the number of patients and the frequency by which they come in is something that most of us who have had a lot of experience have never seen anything like this in our lives before, and it's pretty scary. I think we're seeing the best of humanity come forward. We're seeing, people who were otherwise untrained or unexperienced in anything like this. None of us were experienced with anything like this, to be quite honest. The foundations of our training is what prepared us, and this speaks volumes not only to that training, but to the people who are willing to put their lives on the line to help the rest of the world. And so when you're in the front lines, when you're in the hospital, it feels quite full of energy and full of motivation and full of purpose. And so, yes, there's part of us that's afraid, but I think that is very much the lesser emotion. Empowerment would be the bigger one.
So most of your patients need to be isolated from loved ones while they're undergoing treatment. Does that make it a lot harder?
My first patient, when we recognized that, the disease had taken over and this was irreversible, we had quickly called the wife, his wife, and asked her to come in as soon as she could to see him. And she hadn't seen him in 2 weeks. She would only get updates over the phone. And, the first moment she gets to see him are his last few minutes that he is alive. And, I've never felt such heartache. I just couldn't stay in the room, and I am obviously having a hard time telling you about it because I can't imagine being in her position after 2 weeks of not seeing him and then being called and rushing into the hospital only for him to sort of die in her hands. It's not how we like to practice medicine. I don't think no one wants to go through that.
Did you ever expect that you yourself would be putting your life in such danger as a doctor?
No one goes to medical school thinking that they'll end up being the patient. No one thinks that they would go to work one day thinking that they're going to fall ill from the person sitting in front of them. I did not expect that I would be putting my life in danger ever. And I try not to think about it too much because I think our patients need us. And even if they do pose a risk to our own health, we still owe it to them to be able to treat them the right way. Doctors have a good way of removing themselves from the situation, but this pandemic is different. We're all part of it. We're all at risk. And that person could have been someone that I knew personally. It very easily could have been that, and it certainly brings it closer to home.
So New Yorkers have a new sunset ritual of coming out and applauding their health workers every day. Do you have a strong sense that the city is behind you?
In the days that I'm not working and I get to hear the 7 p.m. claps, I still am yet to go through one of those without starting to cry. It's so emotional, and especially in New York City, the other day they had people singing "New York, New York," the Frank Sinatra song, along with the claps, and that is just beautiful. We're all in this together, whether you're in Sydney, New York, London, Wuhan, we're all in it together, and the faster we get to act as if we're all in it together, the faster this is over.